We're coming to you from Clairwood Hospital here in KwaZulu-Natal, where the Department of Health has refurbished a part of the building solely provided for COVID-19 patients to quarantine and also to isolate. There are several beds, state-of-the-art beds. They will go to aiding and helping COVID-19 patients. But to tell us more about this, I am joined by the MEC of Health, Nomagugu Simelane-Zulu, to tell us how many beds are in this facility, and also, are you happy with the progress that the Health Department has made over this COVID-19 pandemic period?
Thank you very much, and thank you very much for coming. Let me start by explaining that we've not refurbished a building, we've refurbished the whole hospital. And out of the whole hospital, we are going to get close to 154 beds, and these are isolation beds. Of course, you would know that as the Premier has been making announcements, we have said as the province we are going to be getting 7,000 beds in total, and those beds include the quarantine beds. But the isolation beds that we have decided to repurpose in our own facilities in the whole province are amounting to 1,800. Now, well, 1,805. Now, that for us is a great achievement, because when we started this repurposing of our facilities in March, we had about 230 beds only that were isolation, and now within 8 to 9 weeks, we've been able to get more than 1,600 beds out of our own infrastructure and out of our own facilities. That for us is a great achievement. And the other thing that we wanted to emphasize was that it's important for the Department of Health to invest in its own facilities, because even after COVID, these are facilities that we are going to be able to utilize moving forward. And we are also getting ready for NHI, because while we've had a challenge with coronavirus 19, after it and after we've conquered this battle, we are going to continue with the implementation of NHI, and this has assisted us to be able to do so. So in the whole province, like I said, by the end of, by mid-June, we are going to have close to 1,800 isolation beds, but in total we will have about 7,000 beds, which will include quarantine beds in the whole province.
MEC, just break it down for us. At this hospital right now, how many beds will go to isolation, and then how many beds for quarantine, if you can just tell the view at home?
Well, we decided that we want to convert the whole hospital into isolation beds. So the 54 beds that we are getting are going to be isolation, and I think we have about 40 other beds that we are utilizing as quarantine. So it's a minuscule amount really of quarantine, because we wanted, it's easier to get quarantine beds than it is to actually get isolation beds. And the good thing about the isolation beds that we get here is that should we be pressed for ICU beds, we can easily convert the isolation beds that we have with just an addition of a few things here and there to isolation beds, and that's what we can utilize moving forward.
It's roughly looking at KZN province. How many quarantine sites are there right now?
Well, we have quarantine sites in every district. That's why out of 7,000, we say only 1,800 is isolation, and the rest is going to be quarantine. We have created our own sites. We've created field hospitals. We've got one field hospital in Mkungundlovu out of the Royal Showgrounds, and out of that we are getting about 290 beds. And in Durban Exhibition Center, we are also creating another field hospital, and we are getting 450 beds out of that. But we've also created other field hospitals and quarantine beds in the rest of the province. So each and every district is going to have its own quarantine sites.
Thank you so much for your time, MEC. That was the MEC of Health in the province, Nomagugu Simelane-Zulu, just unpacking this new quarantine and isolation building that will solely go towards aiding COVID-19 patients in the province, also breaking down how many quarantine sites are in KwaZulu-Natal. It's back to you in studio.